So this next x-ray is actually Scott. Looking at his x-ray, is he healthy or is he sick? Yeah, he's completely sick. His curve that's supposed to be right here, 45 degrees, is actually curving in the complete opposite direction. That's what we call a reverse curve. So that reverse curve is actually putting crushing pressure on all the nerves coming out of here, including the nerves that are going to his shoulders and to his neck and to his heart. And then if you can tell, I don't know, well, from here, if you draw a line straight up from his shoulder, that's where his ear is supposed to sit. It's up here. So that means he's 54 millimeters out too far. So you're probably thinking, well, like, what does that matter? He just looks funny. No, it's not just that he looks funny. That's his spinal cord that's in there. So if we take the spine and your spinal cord's in there and we stretch it out, just like if you were to stretch a banana in the opposite direction, what happens to it? What happens to the spinal cord in there? It gets crushed, and it's not just a fruit, it's actually your spinal cord. So now it's decreasing any kind of information that your brain is sending down to the rest of your body. So if it's telling it to heal, if it's telling it to repair, it can't hear that and it's not happening. And that's why when he came in, he had severe headaches, he had horrible neck pain and shoulder pain, and he was just miserable. Well, is it any question as to why? So then, how many of you think that Scott should have gone to a chiropractor before he came into my office? Yeah, all of you, right? Well, he did. He actually was going to the chiropractor for 15 years regularly. So should your x-ray look like this if you've been going to the chiropractor for 15 years? Yeah, not at all, not like that. So I asked, why did you keep going to this guy, and how often were you going? And he was like, well, I went to him because he was on my, insurance list. And insurance allowed him to go 1 to 2 times a month. So he was going in and he was getting his neck cracked twice a month, but yet he was still degenerating. So does insurance care about your health? No. And the worst part about insurance is that they actually cause care to they cause care to go up in price. So one of our patients actually was in the hospital last week and they gave her 2 Tylenol and they charged her $65. So I haven't taken Tylenol in a long time, but I don't remember paying $65. The reason they charge her $65 is because they have to charge insurance $65. So everybody has to be charged the same. If I was an insurance doctor, I would have to charge each and every one of you $300 a visit. And if I would recommend 60 visits for your care, that's $18,000. But because I don't sign that contract and I don't sign on with insurances, then I get to give you the care that you need, not the care that you're allowed. And I also get to keep costs down, so that way people with good insurance or with bad insurance or no insurance are able to afford the care that they need. So we got Scott the care that he needed, and we started to get him adjusted. And this is his, this is after 12 months of coming in. So is he working better or is he working worse? Yeah, it's better. He's got a curve actually going in the correct direction, so it's not backwards, but it's actually going the way it's supposed to. So we've taken pressure off of the nerves, and now he can function better. His neck is no longer 54 millimeters forward, it's actually just 8. So like I said, we're working on it, but we've made progress to the point where now more information from his brain is going down that spinal cord to be able to help him heal and repair the way he's supposed to. In fact, 12 months later, he has no more neck pain, all his symptoms are gone. So when you think that, well, I'm going to do what my insurance says, or I'm going to go to that chiropractor down the street because he takes my insurance, I want you to know that I would never give you recommendations based off of what insurance tells me, but what off of your body needs. So make sure that you remember that. This next x-ray, this is Jordan. He came in and he was on pain medication, and he had medication for constipation. So if we look at his spine, what are you guys seeing? Yeah, there's a curvature right in here, and then his hips are off. So if we look here, right there. So his hips are off alignment. They've shifted out of position. So that means that this bone right here, the sacrum, is actually also shifted because it's connected to this really strong joint right in between here. It's called the sacroiliac joint. So when that shifts out of alignment, this whole bone shifts out of alignment, and now it's actually shifting your low back out of alignment, causing that curvature in your spine. And these nerves that are coming out right in here that are being crushed because it's not in the proper alignment are actually going to his intestines. Jordan actually was scheduled for surgery because he had intestinal cancer. That's how bad it got with him. And most people that actually have low back pain, it actually starts in the hips. And when you really think about it, even everyone with the knee problems or ankle problems, it's actually just a hip alignment issue. If you've ever asked an old person if they have knee pain, it's like all of them do, and that's why, because their hips have been out of alignment for so long that it's now causing prostate problems. That's actually causing sciatica. It's actually causing a lot of issues in the low back, but it didn't start in the low back. It's that hip alignment issue. So we started to get him adjusted, and this is his x-ray after 10 months. So what does that look like? It's straight. So now he's healing either at what, 100% or less? 100%. His hips are even. We actually had him wearing hip weights to actually strengthen the ligaments and the muscles around there so that it would hold and he didn't go back to his old misaligned position. And he's off all medications, and he didn't have to schedule a surgery. In fact, he is cancer-free today. So that's how we got to help Jordan. Now this guy right here, if you look at his x-rays, what do you see? Yeah, there's a curvature right in here. And these nerves are being compressed in here, and they're actually the nerves that are going to the musculature right in here and to the different to the digestive issues or digestive organs down here. And this is actually what we call scoliosis when there's a curvature like this in the spine. So we get him under care, and we look at his x-ray after 11 months. And what do you see? He's straight. So we've taken all the pressure off of his nerves. He no longer has the mid-back pain or the low back pain. So he sees this x-ray, this is 11 months later, and he's like, "Doc, you are a miracle worker. I don't have any more back pain. My x-rays looks great. Thank you so much." And then we don't see him again because he quits care. Now, for any of you who've ever had braces or have children who have had braces, you know that once you correct the alignment, you can't just not do anything about it. You have to maintain it. So we don't have retainers, but what we do is have maintenance adjustments to make sure that we keep you there. We have exercises to make sure that we keep your spine in the proper position. Well, 6 months later, John comes back in and he's like, "I have bad back pain again." So we take an x-ray and the scoliosis had returned. So now we have to take an extra 60 days to do that initial healing phase all over again to get him back into proper alignment. But we get him back there, and now he only has to come in once or twice a month to maintain that proper structure. So just because you feel good doesn't mean that you can just quit, because that's our human nature. We all want to do it, but we also know that if we want to maintain a healthy spine, that you need to make those adjustments. All right, just like when you brush your teeth, you don't just brush your teeth really well for a month and then they're beautifully white and then you're like, "Okay, I'm not ever gonna do this again." No, you maintain that. So this last x-ray that I'm gonna go over, it is very special to me. She is one of my favorite patients in the office. This is Layla, and she was 10 months old when she came into the office. Now, don't think that I'm x-raying all babies that come in. This was a special circumstance. In fact, when Layla came in, she had chronic ear infections. Guys, these infections were so bad that there was blood and pus coming out of her ears. So if you've ever had an ear infection for a day or two, she'd had them since birth. She's 10 months old. Okay? She had been on 4 rounds of antibiotics, and still they couldn't figure out what was going on. They put 4 sets of tubes in her ears. It's 4 different surgeries that she had to go through. Now, I don't know how many of you have ever had your child be sick. I don't have kids, but I've been around my nephews enough to know and to feel the pain that they go through when they are sick. All you ever want to do is just take that pain away from them and fix them, because you don't want them to suffer. So if you can imagine how her parents felt for 10 months straight of not being able to make their baby girl healthy and happy. So her mom was actually describing her as a zombie because of so many medications and so much pain that she was in. So if you look here, we actually were, when we took this x-ray, we typically see misalignment in these top two bones, because they're the nerves that go into the ears. We saw nothing up here. It's actually straight. But this is where she's supposed to be. So this crazy curve right here is putting massive, massive pressure onto the nerves that are going to her gut, so her intestines, her gallbladder, her liver, and her pancreas. And yeah, those don't control her ears, but they do control her immune system. So her immune system right now, it is shot. So there's no way that she could fight off all those ear infections. We get her started with care. And this is her x-rays at 60 days. What do you see? Yeah, she's straight. That's straight. So we've taken all the pressure off of those nerves. We've just released it and allowed her body to function, heal. Her immune system's now stronger than ever. She's actually had on no more medications, and she hasn't had an ear infection anymore. She's actually still a patient of ours. So she's healthy, and she's 7 years old now. And her mom actually said that for the first time since birth, she actually had her daughter back. So we're about to go look at your own x-rays in the back, and just want to let you know that 2 reasons that I hear the most about why people don't start care is because they don't have the time and they don't have the money. Now you've heard through different patient testimonies how if it's important to you, you're going to find the time and you're going to find the money somehow. So when we go back, I don't want you to tell me that you don't have the time and you don't have the money. I'm okay with you telling me that you don't want to pay the money and that you don't want to take the time to correct your spine. That's completely fine, because it is your choice. Now, with that being said, I want to let you know that not everybody is accepted to be a patient here in the office. To qualify for care here, you have to be committed to the following 3 things. And the first is that you're committed to your care and to yourself. You're making all your appointments, you're getting adjusted, you're doing your home care exercises, and you're making it to all workshops. All right. Second thing is that we're going to get your immediate family checked. Your wife, your husband, your kids, because if they were building disease, what's the only way to know? What was the only way to know? Through an x-ray. So we're going to get them checked. I couldn't live with myself knowing that we were getting you healthy and we didn't know what their spine looked like. So we're getting your family checked. And the third thing is that this mission is so big that, so many people are out there sick and suffering. Who needed to hear this tonight? Yeah, everyone. That's why I'm never going to quit asking for you guys bring people to us, because it's not about me. You've seen how crazy it gets here in the office, right? There's kids running all over the place. We don't need any more people here, but those people need somewhere to go. And there's not a lot of offices out there that do what we do. So that's why we're going to ask you to keep bringing people to us. What I'm going to do right now is I'm going to tell you what's going to happen. On your next visit, we're going to give you a sheet of paper, and you're going to write down the names of not just the people that you think we can help, but of everyone. Because who needs to know this information? All those people that you know, would they rather know that they have a serious health problem now or when they're in the hospital? Yeah, now. So we're going to have you write those names down, and we will reach out to them and know that their health is their responsibility, but it is our responsibility to give them the chance and tell them the truth. So right now we're going to go back individually into rooms, and we're going to go over your x-rays, and we're going to give you recommendations as far as care plans go and what it's going to take to correct your spine, as well as finances. So I'll see you in a few minutes.